Welcome to Business Insight Fredericton. I'm Krista Ross, CEO of the Fredericton Chamber of Commerce. Today, I'm speaking to Damon Goodwin, who is the CEO of Research New Brunswick. So tell us about the New Brunswick Health Research Foundation. What's it all about?
So the New Brunswick Health Research Foundation is essentially the convener, the coordinator of all the research in the province. And so we are a provincially funded organization, and then we go out and we add dollars from outside of New Brunswick to bring into New Brunswick, and we help coordinate with the universities, both at Université de Moncton and Sherbrooke, Dalhousie University Medical School, as well as the UNB St. John campus. And so the universities, the hospitals, the clinicians, any of the health research that happens in the province, we have a piece of putting it together.
So tell me why that, what you've explained to me, is important to the average New Brunswick person.
Well, I think healthcare for everyone right now is an absolute critical priority. I think if you look at the capacity in the province, it's directly impacted by health research. Most people might not realize how that happens. But if you look at physicians in the province, for example, many of our top specialists will earn this much for their base salary, and then they get a little bit more for research, and then they get a little bit more for teaching. And we can help in those additional areas. So trying to keep Tony Ryman, who's a top oncologist in St. John, that actually, our money comes into play in order to help him do that. From an outcomes perspective, the patient can benefit. The companies learn and are able to develop new drugs. And ideally, you have a great patient outcome as well as investment in the physicians and nurses who are doing that clinical research. They get paid through these research projects. We all benefit.
So give me a real life example of how your organization impacted the lives of people right here in Fredericton.
And you look at the Fredericton Downtown Clinic on King Street, that's one that we invested in those early days. Again, is this a good idea? Is this a great way to impact the health system? Can we improve access? That's a research project. You'll see the logo for UNB there and Horizon, who are partners in that effort, but the initial dollar, the first one to go, hey, let's see if this works, if this is a good idea, was a research dollar. And so the people who are benefiting from access to care in that clinic, it's directly tied to the efforts from Research New Brunswick.
I know there are some changes that have recently happened. Please tell me about that.
Amalgamating those two organizations brings a lot of power underneath the NBHRF, because we have the Health Research Foundation, which is a funder and a coordinator and bringing money together for health research. And then you've got this bio piece, which has been weighing in with evidence-based opinions for many, many years, helping to drive a number of sectors in the province. And so being able to keep those organizations under one roof and coordinate research as a whole in health, learning from that side, helping the other areas, and engaging in research in agriculture, in the areas that bio's been focused on, kind of strengthens that piece. And I'll likely operate that as a bit of a business unit, which can kind of help. It's not funded by the province, it's an independent organization fully, and we are arm's length funded by government, but this will allow us to have a bit of a flexibility, if you will, for driving business and growing business.
So with the combination of BioNB and the NB Health Research Foundation, tell me about the team that you've now put together.
We've got an incredible team, and we'll be adding a few more people. So if I look back at the massive amounts of money that have come in from outside of the province into the province, it's really a testament to the great work of Patricia Seaman, Leah Carr, Megan Seagrave, who were just absolutely fantastic at making those connections and figuring out where the grants were, helping researchers navigate the complex system of research funding. And then on the bio side, Megan and the team, it's really an ad hoc group of PhD researchers, engineers who, as projects come up, we reach out to them. They will grab a hold of those projects, write the paper, put together the position and argument, and then those are often government contracts, but sometimes industry looking for a paper on forestry, benefits of that, or hemp products. Is it a good idea to be farming that? What's the advantage from a climate change perspective? Those are the kinds of things that bio does.
So when I think about Research New Brunswick,
Yeah.
and I think about the Chamber of Commerce, we're a business association, but we do have some members in the not-for-profit sector. Tell me why you think it's important for our two organizations to be engaged together.
I think research in New Brunswick is critical for the private sector to be aware of and understand the impact of. So everybody who has a business and you're trying to lure talent to New Brunswick, how do we ensure that they can get a primary care physician? How can we ensure that when they go to the emergency department, there's an emergency physician there? Well, we help recruit and retain those people, so there's a benefit that way. Our impact on the economy is huge. $60 million into New Brunswick. That means they're buying cars and houses and food and all of that stuff. The economic multiplier is significant. The big companies in the private sector, JDI, McCain, the Cook Aquaculture, they're already investing in significant research. What would be great is to get smaller business to be more engaged on the research side of things and understand the direct impact they can have on the health system as well as the economy by engaging in research.
So how could a small business get engaged or collaborate in this work?
There's a number of ways. So they can participate in research through, for example, the hospital foundations, for example. So if I look at Stan Cassidy, for example, that's one of the places where we fund a considerable amount of research. The value of Stan Cassidy being in Fredericton, I think people recognize the tremendous value of that. So in terms of how to do it, through foundations, Heart and Stroke Foundation, we have partnerships with. The Lung Association, we have partnerships. The Kidney Foundation, we do research together. So a little bit of dollars into a foundation, but headed for research is something we can add a dollar to, go find another dollar with another organization and bring that in. And so it's a way of adding growth to a single dollar that comes.
Recently I saw in a media article that you were talking about how the investment in research is soaring in the province. Can you tell me a little bit about that?
So, and again, this is a testament to the core team that's been there for the last few years. Really looking at some critical issues. So how do we keep people in their homes, aging in their homes, rather than having to go to a long-term care facility or having to end up in a hospital bed? There's been great interest around that. It's really answering those big questions. I think climate change, we'll see a lot of new research opportunities there. And I see a continuation of the kinds of projects around our demographic.
The Chamber has been engaged in the idea of primary care and increasing access to primary care
Absolutely.
since, I think, 2009.
Yeah.
We started our first physician recruitment committee.
Yep.
So tell me how this work that you're doing helps to attract people in primary care.
So access to care, better care is the crux of that kind of research, luring a researcher from another location to New Brunswick and then building almost a team around them of other physicians and researchers. You turn it into a bit of a culture and a community. We've got amazing research being done by Shelley Doucette and Paul Atkinson, a number of physicians in the province, looking at those issues specifically.
So let's say I'm a doctor
Yep.
and I have an idea for research.
Yep.
How do I actually get the money?
In order to get any research done and funded through the NBHRF, you have to go through a peer review process. So we have a very rigorous process for funding. It actually goes through a proper research process that's considered a gold standard. And then once we have that application, we go around and see how we can stitch money together to make it a bigger and more robust project.
So not every project would get funded?
Yeah, in fact, quite a few projects don't get funded every year, sadly. But people take a crack at it the next year, maybe change it, make it a more robust, depending on where their point of entry is. And really that funding is based on a scoring system, and that scoring system is based on something called research excellence. And so you have to have a very high score in order to qualify for that funding. And then you need support from organizations like ours to say this is a good idea, you should fund it.
That's amazing, because if a doctor or someone in the field has an incredible entrepreneurial research idea, they may really have no idea how to access that money. So you're putting it all together.
Absolutely. And honestly, the best ideas come from those frontline workers. When a nurse says, you know what, I wish we did this differently. I wish we could do, this better. Those where some of the best ideas come from.
Question that comes to my mind, if
Yeah.
I'm a researcher and I can go anywhere in the world and do my work, is there an advantage or a disadvantage of being in New Brunswick?
There's both. The advantage from a health economics perspective is enormous. It's enormous. So if you look at Canada as a New Brunswick as a microcosm of Canada, right? We have a same French-English bilingual nature. We have a very similar urban-rural split. We have complexity in that we have two health authorities, we've got the universities, and we have the kind of complicated affiliations with Sherbrooke and Dalhousie. So we've got complexity, but you can still get everybody together on a Saturday afternoon very easily and talk about a situation or research. And so from a health economics perspective, you think of every single company that has a medication come to market, they have to go through a process proving it's of value to the system. In order to do that, they have to take their clinical trials, how they benefited patients, and then they have to overlay health economics to show, is this of value to the system to fund it? So they have to do that kind of research. Where better than New Brunswick?
We're like a perfect focus group.
We're a perfect focus group. We're in an ideal microcosm of Canada, and we're fast. In order to do that research, you must go through a University Research Ethics Board approval process. In Ontario, that can take 9, 12 months. Barry Strack, if you talk to him at Horizon, his REB process on average is 5 to 7 days.
So what's the flip side? What would be the disadvantage?
Disadvantage is sometimes we are not seen as having that research excellence. So the McGills, the McMasters of the world really see themselves as the world leader. The reality is that we do have the research excellence here, and that in the last 3-4 years, there's been enormous strides made in our capacity to do research. We have some tremendous tools that make us very competitive with those larger institutions. That's something that is on our plate to promote so that the rest of Canada understands the value that New Brunswick can bring. We've got John Sesinger, who is a researcher at the Institute for Biomedical Engineering at UNB here in Fredericton, and John develops the AI for prosthetics. So the more you use that prosthetic, the smarter it gets and the more lifelike it becomes.
Amazing.
If you've never been to the IBME in Fredericton, it's eye-opening, and the research they're doing is incredible, helping children with disabilities, helping veterans who are injured and have lost a limb. They are a world leader in prosthetics, and the AI that he is developing that goes with it, it's world leading.
So another member of the Fredericton Chamber of Commerce is the New Brunswick Innovation Foundation.
Yeah.
And they, from what I understand, they actually sound very similar to you, except perhaps with different products. Tell me about how you would be similar or different to NBIF.
The NBIF is innovation funds for when things are a little bit later stage, when you look at a technology readiness level is how it's termed, and then venture capital. They have a great ability to bring in money, again, from outside of Atlantic Canada, and bring that in and invest in companies. We actually do look at commercialization, but more from a policy perspective. Is this a good idea? Should governments be investing in this kind of technology? And the difference there is that, we'll develop the research for a startup company, or a cool app, a neat idea in the early stages. A great example is Breathe Biomedical in Moncton. So we were the early stage funding for Breathe to kind of get off the ground. Now that they're at a stage where they're ready to go commercial and they're trying to raise money, this is a great time for the NBIF to come in to help support the company itself. So it's kind of if it was a volleyball team, we bump, they spike, we work together. And then ONB, from an export development perspective, they can come in and help take it to the rest of the world. And so the three organizations, Research New Brunswick, NBIF and ONB are partners. We work very closely together, and if we do it right, it's like a team, and we're passing the puck and scoring the goal.
Welcome back to Business Insight Fredericton. I'm Krista Ross, CEO of the Fredericton Chamber of Commerce. Next up, we'll learn more about Research NB from Damon Goodwin. One thing that I would say is that people don't know a lot about the work that you're doing. Has it been an intentional secret?
Researchers are, generally speaking, pretty humble, and it's just the facts. So there's not that shameless self-promotion that occurs, and so all of this wonderful work has been happening, and no one's really been tooting the horn. I come from a business background. I come from a background where if you don't say that you're doing great, nobody else will. And so we have a focus right now going forward for Recherche NB, Research New Brunswick, to promote it. So not only will we continue to do the great work, but we will promote it now. And you'll be seeing articles every couple of weeks because we have hundreds of incredible stories that impact people, children in the province, wonderful stories that show the impact of that research, as well as the economic benefits of that research.
How do you see collaboration or communication with or through groups like the Fredericton Chamber of Commerce?
Well, I think your members are critical. You also have your out-of-the-box thinkers, your entrepreneurial mindsets, the risk takers. And so they're the key stakeholders that need to be a part of this process because they're the ones that will help drive and influence that change.
Maybe we need to have mentors from within the business community who can help the researchers come to market.
100%. So when you're at that middle stage, when you're at that point where you're seeking investment from individual investors, when you're getting ready for commercialization, there's nobody better than the people who've done it, who've bled, who know what it's like when the bank is calling and you've got to make payroll and all those pressures that exist. For a researcher, this is the furthest thing from their daily life. And so having a mentor that could participate, helping them develop a product and get it to market, absolutely critical.
What do you think the future of research looks like for New Brunswick?
I hope it increases. If you look at the OECD countries, if you look at the G20, they have a target of as a percentage of GDP, 2.4 to 3% of GDP should go into research and innovation. New Brunswick, so Canada generally speaking, way under invests in research and innovation. And then when you look at New Brunswick, we're at the bottom of the pile in terms of our investment in research and innovation.
So nothing ahead but opportunity is what I'm hearing.
Yeah, we're at the ground floor. We're ready to go up. We need to invest more if we're going to try to remain competitive. And we see areas where massive amounts of research happen. Singapore, Dubai, right? The places that are growing very quickly. South Korea, the United States. The United States will spend $280 billion of government dollars in research and innovation next year. $280 billion. It's a big number. They are our competitors. We are competing with them to get researchers to come, clinicians to come. And so if we don't begin to start investing in research and innovation at a competitive level globally, the lifestyle that we've come to enjoy will diminish. The way to flip that around is to invest in research and innovation, use that as an engine, use it as an engine at the universities, and at the medical schools that creates those students into nurses and doctors and researchers and lab technologists. We need to build it here. And in order to do that, we need to invest more in research and innovation in New Brunswick.
How do you help the average resident of New Brunswick understand the importance of research? And what is Research NB's role in helping them understand?
So really it's about promotion and about talking about the impacts of research and how it benefits a person directly. So certainly patient outcome people will get that. But if they're looking at potholes in the streets and research, they might not connect that a good investment project in research together with private enterprise could find a better way to fill that pothole, a more efficient use of dollars, and so that we end up getting both. So we don't have to decide between one or the other, but investment in research will accomplish what they want to accomplish. And if I look at specifically the healthcare system and the investments in research to improve the system, to improve access to care, wouldn't it be great if we could come up with some solutions that benefit everybody? And that happens by investing in the research figuring out how to organize a primary care health team to get the best result, having the research to be able to prove to government that this is a good idea, and get that funded.
So what's next?
So now that the merger's been successful and that we're now one organization, we are aligned and poised to get more money from outside of the province into the province, to do more research projects, to ideally recruit and retain even more physicians and researchers to participate in trying to make the health system better. And then moving forward to promote the research in the province, to help accelerate it, to help get access. People who might not be doing research right now, but who might want to do research. There's a number of recruitment and retention initiatives both the Chamber is working on, the province certainly has as a very high priority. How do we get more people here? And research is probably the most effective way to do that. You get your best and your brightest. They want time for research. They want to make money for their research efforts. And so that's where we can help bring people here. If everybody does what Newfoundland and Nova Scotia did, so everybody pays nurses more, we do that too. Now our costs just went up and the access to care situation is the same. The issues in the healthcare system are the same. Some nurses might be a little happier and certainly have a little bit more cash, and they do a wonderful job and they do deserve money for what they do. However, from a health system perspective, I would have rather seen the money in Nova Scotia or Newfoundland go into projects that help increase the capacity of the system, that help improve the lives of nurses in their day-to-day job, not just give them a little bit of cash for the pain that they're going through. Why don't we address the cause and make the pain go away? And the only way to do that is through productivity research.
So tell me what you are most proud of that your team has accomplished in the 15 years that NB Health Research has been around.
I would have to say the consistent ability to get money from outside the province inside the province, helping researchers navigate the complicated funding pathways in order to get their research paid for, and getting that money from outside the province. So $60 million has a massive impact on the economy. And that's going into nurses and doctors and people working inside the health system. That's where that money went. And so the team has been very adept at doing that, helping researchers navigate it. I'm very proud of that. And we all should be, as New Brunswickers, for the great work the staff has done.
So my last question today, if you had one simple message to New Brunswickers about Research NB, what would that message be? Research
in New Brunswick benefits everyone. It brings top talent from outside of the province. It helps solve critical health system problems and improve the way that our health care is delivered. And it drives the economy. It's a massive economic multiplier. We need to do more. We need to invest more in research, both as a government, provincially, federally, as well as private investment from the private sector. Needs to continue and grow in terms of investment in research and innovation. Damon, thank you so much for our conversation today. I've learned a lot, and I'm sure our viewers have as well. It's been an absolute pleasure, Krista. Thanks so much for the opportunity to come and talk to you.
We're always looking for great companies with a unique story to feature on the show. If you have suggestions, please get in touch with us.